Paranoid schizophrenia, one of the most debilitating and severe mental disorders. It's what most commonly associate the mentally ill with. Paranoid schizophrenia is an extremely rare mental disorder. It's only prevalent in about 1% of the general population. Although nature and nurture do play a major role in determining whether a patient has schizophrenia. So first, going into biology or nature, you find that the genetics given by your parents can really determine whether you have this disorder. If one of your parents has this disorder, you have about a 10% chance of getting it. If both parents have it, a 45% chance, and if you have an identical twin, about a 50% chance of getting schizophrenia. So what you see in the average schizophrenic patient is that they have brain abnormalities, meaning that their brain ventricles are too large. Also, they will have an excessive amount of dopamine, which we get more in depth into when a psychiatrist prescribes the patient meds. So now moving on to nurture. So nurture meaning your environment that you lived in. So if you had a rough past, this can be pretty much why you're having these delusions and hallucinations. Now this isn't always the case, but it does play a major role. Even though schizophrenia is so rare, it's not subjected to only one culture, age, or gender. Although we do see specific signs and symptoms occur earlier in males than we do females. Today, we'll be exploring schizophrenia through a documented case study conducted by Dr. Papella on his patient, Sebastian.
Hi, my name is Brendan Papella. I'm a psychoanalytical psychologist, and today I have a new patient coming in. His name is Sebastian, and he was previously diagnosed with schizophrenia.
For someone to be diagnosed with schizophrenia, they have to show a specific amount of diagnostic criteria. The two most common would be delusions and hallucinations. So delusions are a false set of beliefs that they think are true, and there are two types, which are grandeur and persecution. And persecution is one that you will commonly see with a paranoid schizophrenic. But grandeur is when they think they're better than everyone else, or they know something that we don't. And persecution, which is what you see that Sebastian has, is where he thinks everyone is out to get him. He is not safe. He always has to look behind his back. And because of this, he cannot function properly. He can't go on in day-to-day life without having possibly an episode because of these delusions that he's having. And from delusions, we go to hallucinations. And these are false sensory perceptions, and this can either be visual or auditory, but visual won't really happen in a paranoid schizophrenic. It's really going to be auditory that makes the difference. And here they hear voices that will give them insulting comments or give them demanding orders that this patient is thinking, I have to perform this if I want to stay alive. They're pretty much telling them that they're bad or this person is out to get you, and even though it's not real, they believe this is true, and because of that, it's another reason why they cannot function properly. You'll also notice with Sebastian that he's never comfortable. He's constantly moving around, fidgeting his hands, not looking at Dr. Papella when he's asking him a question. He just does not look comfortable. He just seems nervous, and there's a lack of trust there because of those voices. Another thing that's commonly associated with schizophrenia is inappropriate language or inappropriate emotions. So with language, it's kind of that they go from one topic to another. They can never be just set on one subject. They always have to go around. It's pretty much called word salad. It's not very common, but you can see it happen. And what you're going to see with Sebastian here is called inappropriate emotion. And this is when they laugh at something that's sad or cry at something that's happy. And something that's probably even worse is actually what Sebastian has. It's called flat effect. It's when they show practically no emotion at all. Even when they're talking about deep concepts or subjects, they just show no emotion and they just don't know how to express themselves. So as we go into this case study, I hope you're able to spot out these signs and symptoms and you're able to see the severity of Sebastian's disorder.
Okay, so this is a documentation of my first meeting with Sebastian. You doing okay today, Sebastian?
I've been better.
Alright, so today we're going to be looking for multiple diagnostic criteria in Sebastian, like hallucinations and delusions. Delusions specifically of persecution, where Sebastian feels like others are out to get him, and hallucination-wise, we're looking for auditory hallucinations where he hears voices. So can you tell me anything about your delusions or hallucinations, Sebastian?
Well, I constantly hear voices telling me to do certain things. It hasn't gotten drastic to the point where it's like hurt somebody or hurt myself. But I do hear many different voices, just random voices.
Okay, do you feel like people are out to get you or anything like that?
Yes, there's two particular voices that always kind of tell me wherever I go that a certain person in that store and that place is out to get me.
Alright, so that's what we're looking for, things like that. We're also going to do two tests today to reveal things from Sebastian's unconscious mind. Those tests are going to be projective tests, things like ink blot tests, where he looks at the ink blot and tells me what he sees, and a thematic apperception test, or a TAT test, which is similar, but you're telling me a story behind the picture. So first we're going to do the ink blot. So I want you to look at this ink blot and just tell me what you see, Sebastian.
I see a face, sort of like a demon-looking face. It's really hard to focus past that.
Can you elaborate any more on that?
It feels like this is, if I were to put a face to the voice I hear, it'd be this one.
Right. So that's definitely something to look out for. And then a thematic apperception test here. So I just want you to tell me what you think the story is behind this photo.
It looks like the man is confused and dazed, or ashamed of doing something with this woman who is in the bed. It seems to me like he had an affair with this woman.
Does that relate to anything you've experienced?
Earlier in my childhood, my father actually had an affair with another woman, and it just caused a lot of conflict in my childhood.
Alright, so that's exactly what I'm looking for, something traumatic that he experienced in his childhood. So yeah, that's what we're looking for today. Thank you, Sebastian.
Thank you.
Psychoanalytical therapy was created by a psychologist named Sigmund Freud in the late 1800s. It did not become popular until the early 1900s. Freud implemented theories such as the iceberg theory, which contained the id, the ego, and the superego, all part of the unconscious mind on how we operate. He was also very interested in the patient's unconscious mind, so he used things called projective tests to get to repressed thoughts in the unconscious mind, which are causes of a specific disorder, in this case, schizophrenia. As we just saw, Dr. Papella gave Sebastian projective tests, which are things such as ink blots, thematic apperception tests, or TATs, dream analysis, but we saw the first two. So when he took the TAT test, which is where he tells a story of the picture he sees, we saw that he brought it back to his childhood and how his father left his mother, and this could be a big cause of why he's having these delusions and hallucinations. It's also the cause of schizophrenia as well, because this is going along with the environment and nurture, not as much nature.
It's been about a month since we last saw Sebastian. We prescribed him medication, but he's refused to take it like most schizophrenic patients. But right now he's in a catatonic state where he doesn't want to move or do anything, so we're going to go check up on him right now. Hey Sebastian. I know you're not feeling too great right now, but the only way for you to get better is for you to start taking your medication, okay? You have to be in on this. You have to want to get better. And if you have any questions, just ask me, okay? I want to help you. Alright, I know you're not in the mood to talk right now, so I'm going to just leave you alone.
So as you just saw, Sebastian was at a catatonic state. And when a patient is in catatonia, it is when they do not want to move or speak or pretty much just do anything. It's just a lack of physical activity. And this can be caused from agitation from their delusions and hallucinations, which is where it's too much and they can't take it anymore. So this is the only way to deal with it. And as you saw Dr. Papella trying to help Sebastian, we saw no response. This is really common because most of the time it's the patient that has to get out of it on their own. It has to be their own motivation to actually get out of catatonia and back into taking the medicine so they can feel better. And treating a schizophrenic is very difficult because they do not want to take their medication. This is because of their hallucinations and delusions, thinking that everyone's out to get them and that this is almost some type of poison. And obviously they're not going to want to take these meds because they believe that what these hallucinations and delusions are telling them are so true. But when a psychiatrist does prescribe the medicine, it is going to be an antipsychotic which will reduce or even eliminate the hallucinations or delusions they are currently having. A biological factor of schizophrenia is that the patient has too much dopamine, and what the antipsychotic does is it acts as an antagonist, and it blocks the receptor sites or dendrites, meaning the dopamine level decreases, which in return means less hallucinations and less delusions. Now, common antipsychotics would be clozapine, promazine, thorazine, and Haldol, and there's obviously more, but those are just some common ones that psychiatrists will particularly prescribe to the schizophrenic patients.
It's been about 6 months since we last saw Sebastian in his catatonic state. He's been consistently taking his medication now, and we're going to see how he's doing. This is the follow-up appointment with Sebastian. Today we're going to be seeing how he's doing and how he's improved since we last saw him. You doing all right today, Sebastian?
I'm doing good, Brendan.
All right. Can you elaborate a little more on your hallucinations and how those have improved?
I've been doing a lot better with that. I really haven't been hearing voices as much. Just been kind of living normal.
All right, that's great. No more delusions of persecution, feeling like people are out to get you or anything like that?
No, not at all. I've been able to go out, hang out, and just live a normal life for the first time in a while.
That's really great. That's a lot of evidence that you're doing a lot better, and just as some more proof, we're going to give you that same ink blot test from a while ago from that first meeting, and I just want you to tell me what you see in that.
Alright, well, the shape of a face is there, but it's vague. I just see different shapes and shadows. It's really meaningless at this point.
Really neutral?
Yes, sir.
All right, that's great. So we can obviously see that Sebastian's doing a lot better and that he's on the road to recovery. We're going to continue with some more therapy and the medication, and hopefully he'll be doing great.
Sounds good. Thank you.
Thank you.